Hello, my name is Allison Clark, and today I'm going to be talking about treatment and rehabilitation prevention for women's basketball. The first major injury is an ACL tear. In an ACL tear, it happens when you change speeds too quickly or pivot. So, for example, if in basketball, if you were to do a quick crossover and your knee buckles, or if you were to come down for a rebound and land it on your leg too strongly, that will most likely cause an ACL tear. What is happening anatomically in this is your kneecap sits in front of the joint to provide some protection. The medial collateral ligament is on the inside, and the lateral collateral ligament is on the outside. They control sideways motion of your knee and brace it against unusual movement. When this happens, it's because your knee buckles and it prevents the tibia from sliding out in front of the femur. There are 3 different sprains in an ACL tear, 1 being the least crucial and 3 being the most. Most ACL injuries, though, are complete or near complete tears. There's 2 types of treatments for this. One is surgery, either arthroscopy and ACL reconstruction, or 2 would be physical rehab. So if you just have a grade 1 sprain, you probably don't need surgery, and you could probably just go ahead and complete physical rehab. If not, then surgery is definitely recommended. So for the rehab exercise, I have chosen knee extension and flexation, which I have Jessica here to show us how this exercise works. So basically you sit on the edge of a chair or a bed with your knees bent. You're going to want to slowly straighten the knee of the involved leg to the count of 2 and return to the bent position on the count of 4. You'll want to repeat this 10 times, which completes 1 set, and perform a total of 3 sets with short 30 to 45 pauses between sets. The second injury that we have is an ankle sprain. So this can happen when landing on another player's foot as they come down from a rebound. The outside of the ankle achieves its stability from a 3-ligament complex. The 3 ligaments are anterior talofibular ligament, calcaneofibular ligament, and the posterior ligament. In an inversion sprain, the anterior ligament is the most commonly injured. And ligaments in the ankle are named according to the bones to which they connect. The treatment for this would be RICE. The RICE treatment, which is pretty popular, it consists of rest, ice, compression, and elevation. And then in rare cases, surgery is performed when the injury doesn't heal or the ankle remains unstable after a long period of physical therapy and rehabilitative exercise. A prehab exercise you can do to strengthen your ankle is the towel scrunch. You should practice this exercise for 30 to 60 seconds on each foot, and this prehab exercise will develop dexterity and activate the intric muscle actions of the foot. So that will provide a foundation, and it improves coordination and also agility, in addition to helping posture and balance. So the rehab exercise is range of motion. So I have Jessica back to show us how that works. So you'll sit in a chair with your foot flat on the floor. What you'll want to do is slowly move your knee side to side while keeping your foot pressed flat. And you'll want to do this for about 2 to 3 minutes. You should complete these exercises. Then you'll want to put ice on your ankle 5 times a day for as long as needed until your ankle heals. So this is an easy exercise you can just do at home. You don't necessarily have to go to a physical therapist to complete it. You'll just do just as she's doing, keep your foot flat and move your knee back and forth side to side without lifting your foot. And the last type of injury that occurs in basketball is going to be jammed fingers. So Jamming a finger is common in any basketball game. The easiest way in basketball to jam a finger is going up for a rebound and the ball hitting the tip of your finger in a bad spot. Also, it happens if you catch a pass and your fingers bend backwards in the wrong spot. This injury occurs from a blunt impact or forced motion to the proximal interphalangeal joint of the fingers. Depending on the severity of the impact, which will stress the ligaments at your PIP, the varying degrees of this injury will range from a simple jam to a more serious fracture or dislocation. There's only 2 treatments. You can't have surgery or anything on a broken finger. You just have to let it heal on its own. You can use the rice therapy, which we talked about before, and buddy taping is also recommended. So with buddy taping, you'll just tape 2 fingers together and just play like that. Because jam fingers occur from a traumatic impact, they're difficult to prevent, so there's really nothing you can do to help lessen the extent of these injuries. But I do have a rehab exercise, finger extension. So Jessica's back one last time to show us how this works. So with the finger extension, you will keep your hand flat on the table, and you'll just move up and down the finger that's injured 8 to 12 times every hour, 7 days a week. While doing this exercise, you should see your finger start to minimize in swelling, and you'll be able to bend your finger a little more and more every day. So, alrighty, that's it.